Tanzania has one of the worst health records in the world. It has the worst ratio of doctors and nurses to patients. In England, the average is 1 doctor per 420 patients. In Tanzania, it's 1 doctor to 52,000 patients. The World Health Organization has life expectancy at 62 years, yet Tanzania Public Health records a figure of 53. HIV affects 18% of the population, but this figure only accounts for the diagnosed cases. The biggest cause of death in children is still malaria. Only 24% of Tanzania has safe water supplies. The vision of the Tanzania UK Trust involves the community work of the Tazama Natunza team and the plan for a health centre. The aim to provide diagnosis, treatment and medication people can trust. This is God's work and we are in partnership with him in Tanzania. The church in Dodoma was built in 1993 and the congregation has grown from 0 to around 1,000 with church plants. To the right of the church stands Mavuna House, where the church and community offices are. The building beyond houses the compassion classrooms. This is a site built on prayer, and here's where it all started, the House of Prayer, which was built from mud bricks before the church. Pastor Samson prayed and fasted here for 40 days for the building of the church. Now they have 3 back-to-back services on a Sunday morning, and Pastor Samson has the blessing of working alongside his deputy pastor and son, Zephaniah. In this church, health work and mission go hand in hand. As part of her recent medical visit, Ruth taught on cancer prevention to members of the church and the wider community. She even got them moving. Tazama Natunza means look and care. The April 2015 visit saw Ruth continue teaching the team of 30 volunteers from the church addressing chronic health conditions. Sessions included learning how to communicate the importance of healthy diet, hygiene and exercise. The Tazama Natunza volunteer leaders include Leah and Yolanda and Ade, seen here addressing the group before morning visits. Ruth and Tanzanian nurse Hilda lead community visits within the team, showing the volunteers how to engage with patients so that they can ask the right questions, make correct observations and offer the right self-care and treatment. The team operate under the local doctor, Dr. Moto. He believes the Tazama Natunza project meets the needs of the community and addresses the lack of information and education around chronic health care. This is his laboratory, and just have a look at his high-tech, equipment-laden consulting room. In Tanzania, if you have a project, you must have a geographical base. So the Archbishop declared that the project must have a health centre. Each of the 5 cell groups in the church are responsible for working on a different zone of the health centre site. For 3 months they have put the kingdom of God first, only buying food to eat, and every other penny they would have spent has been donated to the build. There have been jobs on the site that builders must do, but church members have put their backs into the heavy work of filling in the foundations without equipment or machinery. Here's Pastor Samson's wife Margaret showing how it's done. Everyone is keen to be involved, whatever their age. This is how the site looked as our trip finished in April, but the hard work didn't stop, as you can see from Pastor Zeph's updates. There have been challenges, and the water pump had to be replaced at a cost of over £1,500 so that cement could be mixed. The physical foundations of the health centre are complete, but the real foundations of the project is the work of the Tazama Natunza volunteers. So why go out visiting? Quite simply to offer holistic care to those who are too frightened to seek help because they have no money for medical care or treatment, and none is free. This is Brighton. He has diabetes. Can you imagine what it means if his parents have no money? No doctor's visit, no diagnosis, no medication or treatment. Volunteers were able to make a referral to the doctor, and Tazama Natunza has found a sponsor for Brighton's insulin. After meeting this boy with a deformed leg, the team sent him to see the doctor. Unfortunately, the condition is too complex and expensive to treat now. If he had been seen years earlier, it would have been treatable. The team also support Elizabeth. In her 80s, she has poor vision, arthritis, suffers from depression, and lives alone in a mud brick house with a roof that keeps blowing off. Tazama Natunza have been visiting Leah, who has AIDS, but sadly she asked for help too late. The team took her for her HIV medication and treatment, but the infections had too strong a hold, and Leah has since died. Ade from Tazama Natunza cared for her to the end. Rahima, also living with HIV, is a member of the volunteer team. She is now radiant with faith and peace, as she has learned how to look after herself and knows God cares for her. Back inside the church, there's a verse that sums up the work here. Psalm 60, verse 12. With the help of God, we will do great things. The foundations of the health centre are finished, but this is just one step on the journey of a bigger challenge. God fulfills his promises in this place. We all have a part to play. What will you do? Tazama Natunza, look and care.